Hey dancers, it's Kirsten. Welcome back to the Confident Dancer YouTube channel. And now, if you didn't know, podcast. Also, if you're watching this on YouTube and you'd prefer to listen to this wonderful interview I have coming up for you in a podcast form, then you can just go to Apple Podcasts or Spotify Podcasts and look up the Confident Dancer podcast. And I hope you enjoy listening to it there. I'm so excited that the podcast is now launched. I've been getting questions about that for a very long time. So it's finally here, and you can look forward to seeing all of my future YouTube videos in podcast form every week. And as well, if you're curious, I think I'm going to also put on the podcast some previous YouTube videos, because if you've looked at my channel, I have over 470 videos at this point, so I'm sure I'll put some of those up as well. But anyway, aside from that little announcement, I am excited to introduce to you my new friend, Christa Christianson. She is amazing, great personality, super knowledgeable, and if you didn't know, what she does professionally is she is a physical therapist for dancers specifically, and she's also an NCSA certified strength and conditioning specialist. So she really knows what's up in terms of helping dancers condition their bodies to prevent injury, come back from injury stronger, and generally dance stronger and better. So I think you'll really enjoy our conversation. We talked about the root causes of most hip and ankle injuries. We talked about how to best warm up for class. We talked about unfair expectations most dancers have of their bodies, how to really improve your flexibility the science-backed way, and so much more. So I hope you really enjoy this conversation, and if you do, definitely give this a thumbs up on YouTube or on podcasts, give us a review. So thanks for watching. Enjoy all that my friend Christa has to share, and give her a follow on Dance Evolution on Instagram. I'll have all of her info below. But yes, thank you to Christa for being here, and to all of you watching or listening, enjoy this episode. Christa, welcome to the YouTube channel / podcast now. I'm so glad you're here.
Thank you. I'm super excited to be here.
Yes, we had such a good time chatting on your podcast. I'm super thankful you reached out to have me on, and I just thought, like, of course, duh, I need to have you on my YouTube channel, so here we are.
This is so nice. I just really love your energy and your personality. I can see why you do well on YouTube. You're just so endearing.
Thank you.
Yeah, and knowledgeable. And so I'm honored to be here. Thank you.
Oh, you're sweet. Whenever I was auditioning as a professional, well, it was like pre-professional, and then when I was re-auditioning as a professional, I was always like, dang, I feel like I have a good personality, and I wish personality counted for more things. And
You're practicing life for personality.
But alas, it's maybe only 5%. But whatever. I'm here, and it's fine.
You probably are really good on stage, though, right? If you have a good
I would like to think so.
Yeah,
good. I will be the judge of that, but I think so. Anyway, let's talk about you. I would love to hear, let's kind of start with what it is that you do now for dancers, and then just kind of backtrack and tell me how you got there.
Cool. Awesome. So I am a dance physical therapy clinic owner. So I treat local dancers as well as dancers in California, because that's where my license is from, virtually. But I wanted to be able to make this information that I've learned over the years available to more people. So I've launched an app, and on the app, there's just resources for dancers and instructors of like scientifically based technique and exercises and things like that. And then I also, for those people who want to work with me that maybe aren't in California, I do coaching. So essentially, we talk through what are the barriers to your success as a dancer, what are your goals, and then how can we get there. So that usually involves, I try to take a holistic approach to it, looking at your whole life and what's holding you back. But we really, obviously, based on my background, we focus in on like physical wellness and making sure you have a customized conditioning program and all the good things. Injury prevention and customizing things for dancers. So
yeah,
super happy to say that that's what I do, because it's been a long process to get here. So, yeah, I've been dancing, typical story, since I was 3, and always really loved it, was just like all in on ballet. And then started having injuries around the young age of 10. So I started
Oh my
having,
gosh, little
yeah.
baby Christa. Oh my gosh.
And then from then on, I was just perpetually like the injured dancer. I feel like there's probably one at every studio. It's like someone who's always
I
hurt.
was that girl. Oh my gosh. Like at one point, and it's so demoralizing. Oh.
Yeah, it's frustrating. So yeah, so I started having hip pain when I was 10, and I didn't really know like what was going on. I went to therapy. I saw some doctors, and I didn't really get a specific diagnosis for it. Eventually I just kind of learned to live with it and just kind of push through it. And then I was that dancer that was like, I love dead point shoes. They're just easier to dance in. And I got I fractured one of my metatarsals in my feet, and decided that I didn't want to give up my full scholarship summer intensive because of that. So I went anyways. And yeah, like just
I get that. I really do from an emotional standpoint. And I bet from a physical standpoint now, you're like,
yeah. Yes. Well, I found out the night before. We got the MRI results the night before.
Fair.
The night before the summer intensive, and I was like 13. I'm like, oh, I want to go anyway. So I did, and big regrets. Like, I didn't realize that, continuing to dance on an injury just prolongs your recovery time. I didn't really think that through. So I was in a boot for a year. I missed Nutcracker that year. I was like so sad. It was a very hard time for me. But eventually, like I rehabbed from that. And at that point, I knew I wanted to be a professional dancer. And I was concerned that that injury was going to put me back like really far, because my calf was like this. I didn't move my ankle for a year, but I did a lot of rehab and got myself back, and was dancing really, really well. And then I sustained a lower back injury. So I didn't find out till later, but I actually had fractured a vertebrae. So I'm telling you, like, I'm like the girl that's always hurt. And like along the way, I had like every ankle pain you can think of, knee pain, neck pain. Like, I just was kind of a mess.
Yeah.
So I'm thankful for that now, because I can really empathize with people when they have injuries. I'm like, oh, I had that. I know exactly how that feels.
Yeah.
And I was, but obviously frustrated by that. So I took an interest in like understanding my own body and understanding just like human movement and human anatomy. So it's just really interesting to me to understand like how we move and why we get injured. And so that sort of like put me on the path toward being a PT. Plus I knew I wanted to help people, and I thought the healthcare career was like a good thing to go into. So there's that. But another piece of the puzzle that I wasn't expecting, I kind of always felt like I couldn't perform as strong as I wanted to on stage. And we talked about this in our previous conversation on the podcast, where it's like probably part panic before a show and part asthma and part like just I felt like I didn't have the stamina or the strength to really do super well on stage. And that was so frustrating to me. And that was something I always struggled with. So fast forward to college, I wasn't taking as many classes as I used to. And I realized, I need to stay in shape somehow. So I signed up for a weightlifting class and took that a couple of days a week. And I cannot even describe to you what a game changer that was for me. I had never set foot in like a gym. I didn't know what any of the equipment was. Like, I had only ever done like Pilates exercises or like crunches and like running up and down the stairs to try to work out. So I took this weightlifting class, and I tell you, like, all of a sudden I was doing so well in class. I'm not really a turner, but I went from doing like doubles to consistent triples, quadruple pirouettes, like consistently. My décolletés were higher. They didn't hurt anymore. Me with the hip pain, like my penchés were 180. Like I just had so much more control, and performed so much better. And that was kind of like my aha moment. I think everyone who picks a career that they really love, that they're passionate about, goes through like 2 phases, like the trauma phase and then the aha phase.
The mess to success. I tell you, it's my favorite thing.
I love that. Yeah. So the trauma phase, like me always injured, not feeling like I can perform strong enough. And then my aha moment was like, what the heck? All of a sudden, I can perform how I want to because I'm taking weightlifting twice a week. Yeah. And that I was like, dancers need to know. Like the world needs to know. Because we don't do that often, so people are like, dancers are starting to lift weights a little bit more, but like it's still kind of a taboo thing and people don't really know where to start. So that has become like an integral part of my passion of helping dancers. It's like empowering them physically through guiding them through conditioning, things like that. So yeah. So I danced professionally in Idaho in a contemporary company, and that was such a great experience for me as an artist. But I ended up just all of my injuries bubbled up at once. I had my hip pain, my back pain, my knee pain. I was like, it just hurts to sit, you know. My friends would call me, be like, "Hey, let's go out dancing," and I'd be like, "I can't. My hip hurts." They're like, "What are you, 90?" So, so I decided to make that hard decision to stop dancing professionally, and had a kid and went to physical therapy school, and I worked at an outpatient sports clinic, and I worked at a holistic wellness clinic, and then decided to start my own thing for dancers. So it's a long road, but that's kind of like where I came from and why I do what I do now. So
that is so great. And I think empathy is such a great starting point for being a great practitioner of whatever it is that you do, whether it's mindset coaching or physical therapy, strength and conditioning, truly anything, or like career coaches for dancers or mentors. Having that empathy of knowing what the struggle feels like. I think anytime I've worked with someone who I know has that empathy, it just feels like they create such a safe space where I feel like I can trust them more. And because I trust them more, I am more prone to doing what they say. And it just ends up being such a more effective and fulfilling experience as the client. So I love that you're able to offer not only your empathy, but also, of course, your skill and practical training for dancers, because especially with recovering from injuries, preventing injuries, even warming up or doing things to enhance your technique as a dancer, there's just so much misinformation that I'm sure you are 100 times more aware of than I am. And I'm aware, like, there's a lot of ineffective stuff being talked about and taught to dancers out there. So I'd love to start with asking you about warm-up routines. This is a point of personal curiosity for me because I see that every dancer has their own approach to warming up for class. And I kind of wonder what are the general kind of boxes we need to check from a professional perspective in order to really be prepared for a class?
love these questions. So everyone is different. And so that's okay that like everyone has a different routine. But we like to try to stay current with the latest scientific evidence, right? So kind of the latest in the last about 5 years, popular warm-up sort of regimen is called the RAMP method. And it's an acronym RAMP. So you would walk through those 4 categories to warm yourself up properly so that your body is ready for whatever you throw at it and not surprised, because when you're kind of surprised, and then that's when you like sprain your ankle or you pull something, right? So the R stands for raise, and this is when you're raising your body temperature, your core temperature, as well as your muscular elasticity, turning on your nerves, getting everything kind of awake, right? Increasing blood flow. So that looks like maybe prancing around the room or doing a quick jog, running backward, running forward, sideways shuffles, high knees, jumping jacks, whatever you want to do to just get your heart rate up, right?
Mhm.
So I always start my classes off that way. And then the A is for activate. So you want to be activating the muscle groups that you're going to be using during class. And for dancers, that's core, right?
Yes.
Your booty, your hip flexors, your side muscles of your hips, right? Your abductors,
Yes.
your calves. So just any sort of movement that gets those awake. So I like to do kind of like down dog with the bicycling of the feet. I like to do high knees. I'll do like toe touches to try to get the backs of the legs going, lunges, side lunges, things like that. So it's really more active than sitting down and stretching, right?
Yes.
Yeah.
Oh my gosh, that's so good because, I've kind of thought retroactively about my college experience. And when I was at the University of Utah, I went from getting injured all of the time my last year at Houston Ballet Academy to actually, I felt so fortunate that in my 3 years at the university, I did not get injured. At least there were minor things,
Yeah.
but it was never to the point where I'd have to sit out for sustained periods of time. It
Right.
never affected my ability to perform or I never had to miss out on opportunities. And that was such a life-changing thing for me. And I realized one big difference was that I would simply, because I was on campus, I was walking to and from my classes all day. I would get in about an hour of walking every day. And I noticed that every time I would go to my dance classes, I was almost always walking uphill. And so by the time I sat down and was ready to like maybe do a couple stretches to get ready for class, my heart rate was elevated. My muscles felt warm. I was more relaxed just because I had already activated those muscles, especially, going uphill. I'm using my glutes, my hamstrings, my calves, and quads too, and like pushing upstairs and stuff. And I think that actually made a huge difference because I was also cooling down walking back to my house or walking to my next classes before, at the end of my day. And do you think that would have made a big difference for me in terms of like injury prevention?
It could have. Absolutely. I always say like it's usually the perfect storm that either creates a positive environment or a negative environment. So it's never just like one thing, but if you
Sure.
can really try to like surround yourself with a lot of positive things and you get a good outcome. So yeah. So that's great.
I've always
Uh,
just been curious about it because I'm like,
yeah. But
what was different? It was that.
it was that. I was like walking upstairs. Yeah, it really is important to like get everything warmed up
Yeah.
and activated. And then the last part of it, you do want to mobilize because we
Yeah.
do work through a lot of ranges of motion, right? And we want to make sure we can open that up. So that's when you're going to be like going through movement patterns that you would use, like getting your legs up or, rolling through your spine or doing some rotations, mobilizing your joints, usually more actively, right? And then the last one is potentiate, P for potentiate. So essentially, you're going to get yourself up to the level at which you're going to be dancing. So say your dancing is like going to be an 8 out of 10 intensity. You want to get your warm up to an 8 out of 10 so that you're really there and ready to go. Now, for ballet class, we usually do the potentiate like through the bar, right?
Yes.
So that by the time we're in center, we're ready for that. If you were just doing like your own warm up before a show and you don't have a class or something like that or a competition, then you'd want to make sure you do the potentiate. So yeah, ramp. That's my answer for you.
So good. Oh, I'm so glad I asked that question. Even selfishly, I'm totally going to use that.
Yay.
Yes. And I
Post your
also know that oh, sorry, I totally cut you off. What was that?
Oh, I said you should post videos of and pictures of your warm up. I'll be very proud.
Okay, accountability. We should add ramp A. Accountability for that last name.
Accountability.
Ramp up. So I know you get a lot of questions about ankle and hip injuries and like how to prevent it, how to recover from it, deal with it, whatever. And so I'm curious about what are some root causes you often see of these ankle and hip injuries for dancers?
Yeah, I spend a lot of time thinking about these things.
But
I think it's really three things. So the first is overuse. We use our ankles and our hips kind of a lot more than a normal human would,
yeah.
right? So when you add up all that volume of dancing, then the body's kind of like, whoa, this is a lot. That's the biggest reason why I see injuries most of the time. The second is proper training. So you want to make sure that you're strong enough to be doing what you're asking your body to do. And this is a concept that I didn't really realize or understand until probably college. But just because you're dancing doesn't mean that you're strengthening, right? So you're thinking like, well, I use my ankles all the time, so aren't they strong? Like, why are they getting injured, right? So but dancing, like when you first start doing a certain activity or physical activity, you will get a little bit of strength because your neural connections are getting better and you're using your muscles, right? But then you plateau. So you actually have to be doing targeted strengthening in order to actually build up strength. So I like to use the analogy of like a paper clip. So let's say you have just kind of like a regular paper clip and you are the paper clip, or your ankle is the paper clip, okay? And you're dancing all the time, so you're constantly bending the paper clip, right? So eventually it's going to break, right? It's going to get injured. And so the dancing is like the bending of the paper clip. But the strengthening, when you do targeted strengthening, it's actually making that paper clip thicker. So now you have a stronger paper clip, and when you do the same amount of bending, it won't break, right? So you have, yes, that's kind of like how I describe it. It's like dancing is more of like the movement, and the strengthening is really going to fortify you for the movement. Right? So you got to make sure that you're not overusing, watching your volume, but also doing targeted strengthening. And then the last one that I get really nerdy about, the third thing, is that everyone has a different body. We don't all have the same joint angles. Like some people's hip sockets face this way, some people's hip sockets face this way, like some people have scoliosis, so it's like some people have knees that turn a little bit more, right? And then we try to fit ourselves into this cookie cutter ballet class or like these cookie cutter movements. And that can really injure our joints when we're pushing past our available range of motion. So what I like to do with dancers is do like a full body assessment of passively, what do your joints have? And then how can we work within your own personal range? Right? So depending on your personal hip socket, your passe is going to look different. Your développé is going to be in a different position in space. The way that you perform the steps are all going to be unique to you. So working with someone that can help you find that will help reduce injury. So the next time your teacher is like, turn out your passe, you can be like, and just keep doing your thing, because you know that your hip is not meant to go 180. Like you're here at 85. You know what I mean? So I think that's the third thing, is knowing your own body and your unique anatomy.
That is so good and so empowering too, because I feel like it's such a common experience, especially for ballet dancers, to look at other dancers' bodies and to think it looks so easy for them. It looks natural for them. Why is it so hard for me? And of course, we can't literally feel what that person is feeling. We don't know how easy or hard it feels to them. And also, it's somewhat subjective, like what we call easy or hard. But I'm sure taking that targeted approach to look at your body and also look at it from this angle of like, it's not bad. Let's just work with it to maximize what you have instead of judging it. Because I feel like often, especially in the ballet world, I see dancers feeling a lot of judgment towards their bodies for not working the same way that they see this other dancer's body working. I used to be like so hung up on like in this stretch where you put your ankles in the top of each other. Oh my gosh, it was like this. When I was 14 years old, I could barely even get into the
Yeah.
stretch. And so someone, I mean, if they were super old school, could have looked at me and like completely written me off.
Yep.
Like, you have no potential, you have no business doing this, you don't have rotation, blah, blah, blah. And what is so great is over the years, I had some teachers who encouraged me to force my turnout, force my flexibility,
Mm.
or I felt like I just had to do that to keep up. And then I had some teachers who really looked out for me and said, like, okay, this is humbling, but I see these muscles aren't activating, and you need those muscles to activate in order to properly rotate. And so they helped me kind of remove some of the shame of like, okay, I maybe can't do the flashy stretches like other people, but functionally they help me to kind of make it work to where I can do the movements in ballet and the positions that were ultimately required of me to be a professional dancer. So I love how you as a PT can take that personalized approach and also maybe emotionally be that source of encouragement and removing shame. Like, nothing's
Yeah.
wrong with you. We just need to work with you in a way that works for you. That's it.
Totally. I love that. And the goal is not to be perfection in class,
Right.
right? Your goal is to perform well and enjoy what you're doing. And you know what I mean? So it's like you may not necessarily need that hip motion or that rotation. It's like, I love your story. Like, look at you now, you made it.
Look at me now.
You know,
Everyone wants to be like me.
even though you couldn't stack your hips. Yeah. So,
I know. It's funny.
and
I did get there. Like,
yeah,
I can do that stretch and I find it comfortable now. But man, if I would have given up on myself, or if I would have hinged all my success on like, I can't do the middle splits. What's wrong with me? Instead of looking at, okay, what can I do? How can I work with that?
mhm,
What are the areas of potential that I have that I can really invest my energy into? That's what I'm always telling dancers. Like, it's great and totally a part of the process to look at what's not working for you and try to make some movement in that area, make some improvement. It's great. But if we use all of our time and energy and like headspace to focus on what's wrong with me, why can't I do what she's doing over there? This teacher doesn't like me, I can't get into that program. Instead of looking at, okay, what do you have that's really going for you? And how
yes,
can you maximize that? And I always tell dancers there are going to be teachers out there who are on your team. There are
yeah,
going to be companies out there who are looking for someone like you. And maybe it's
yeah,
not ABT, but that's okay. Maybe you wouldn't be happy at ABT, so it's okay. Anyway, I could just
yes,
go off on that for anyone who's like really needing that encouragement of like every body is different and you can work with it.
that's all right. Yeah,
It's okay.
totally. Yes.
Yes. Let's also talk about flexibility. That's a big
Yes.
one. So, what are some, I guess, misconceptions that dancers often have about the process to gaining flexibility? And what approach would you suggest?
Yeah. Okay. So there is this big misconception that stretching will lengthen your muscles. That's actually false. So the only thing that stretching does is gets you to your personal maximum range of stretch in your muscle.
Mm.
Okay, so your muscles are made up these little fibers that crisscross. Essentially, what you're doing when you stretch is you're just uncrossing the fibers.
Yeah.
Okay. You're not actually making the muscle longer, and the effects of stretching do not last. So if you're a dancer that's like beating yourself up because you're just stretching, 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 and nothing's happening, which I see a lot, it's because maybe you actually need to create more length in your muscle. So the way that you actually do that is through what's called eccentric exercises, right? Eccentric loading. So that is the slow, controlled lengthening of the muscle. And you want to load the muscle at end range. So you essentially go to the place where you feel like a deep but comfortable stretch, and that's where you load the muscle. So you like control it into your end range with resistance. And it has to be enough resistance that it actually stimulates the muscle to start growing. So then what happens is when you exercise that way, you lay down more muscle fibers in series this way. So then you can actually, you just have more availability. And you have more control over your movements. So you have the most control over your movements in like a middle position, something like this, right?
Okay.
So you can have a longer muscle, and then just whenever you're doing your dancing, you're just more naturally in that neutral position. You're going to have more control of your movements.
Interesting.
Yes, isn't that cool?
Yeah, it really is. I've heard different ways of describing that, but what I hear the most from friends like you who are actual like physical therapists and whatnot, it's like you don't just stretch out your muscle to be longer just by like sitting in your splits.
Right.
So I'm seeing now like exercises about like, for example, lunges. Instead of making it a passive stretch where you just sit in it as deep as possible, I've seen exercises where you have like some level of activation. You're not completely sitting in your end range. You're kind of like having some movement or some engagement to those muscles. And it always feels so much better when I do that. I don't feel like I'm kind of like stressing out my tendons, you know?
Yes, exactly. Because what happens when you do sit in your stretch and end range for a long time is you do stretch out your ligaments. So the ligaments that are keeping your joints together and keeping your bones in place, they do get stretched out and they don't really come back. They're not elastic. So that's when we start getting a lot more joint play, we get a lot more movement, and then we start getting injuries. So that's why you always hear like exercise people like me online being like, don't just hold a passive stretch. I
Stop it.
Yeah, because this is bad for your joints. And yeah, it's better to just work through things with eccentric. Now, stretching in and of itself is not bad for you. It is good to try to like loosen up the muscles. I recommend doing it at the end of class after you use your muscles and they're like this at the end of class, get them back to neutral, right? It just feels good. It's good for recovery. It's good for unwinding after performance or anything. But
That's so good.
yeah.
Okay, little bonus question on that. How important is it to do some sort of like stretching cool down after class or rehearsal?
It's so important. Yeah. Because like I said, when you're, dancing for what, hour and a half plus, your muscles do get tight and you can kind of get all out of whack. If you're doing like renverse to the left 50 times in your piece, and then your left quadratus lumborum is like cramped up and you walk around like that for a couple of days, it just kind of predisposes you to being out of balance. So what I work with on my patients is like finding symmetry, and none of us are perfectly symmetrical, but people who are more symmetrical usually have less injury. So like trying to just balance your body after you're done dancing. And yeah, just self-care, getting those metabolites out. So doing like some massage or like ice bath or all those kinds of things are really good for getting all those, the waste from your muscles essentially out of your system so that you're less sore the next day.
And I imagine hydration is a big part of that, isn't it?
Yes, absolutely. Yeah, all those metabolites go into your blood system to get filtered out, and you want to have good hydration in your blood so you can do that well.
I'm gonna get my big obnoxious cup right now. I'm like motivated.
Cheers.
Cheers. Okay, little side note that is not relevant to this episode, but we're including it anyway. I take this cardio dance class that is life. It is so fun. It is the only way I will do cardio. Seriously, like we just dance to pop music, and the teacher got me this for my birthday. It is so short too. It's like a massive, the size of my head. Anyway, I don't know if any dancer listening is like, I need to improve my cardio, my stamina. Maybe like, I'm not the professional in this arena here, but take a little cardio dance class. It's a great time.
Amazing. Honestly, I've like been craving that.
It's so good because the whole like running on a treadmill thing, I'm like, I
It's just, yeah,
don't want to do it. I don't want to do it.
it's not as fun, definitely. I know I'm a little ADD, so I have to have like 3 different things going on at once. So if I'm like can distract myself from my workout, it's much better.
I know, especially community accountability, I'm realizing is huge for
Yeah.
me. If I go to a class, and I bet this works really well for your patients too, like having the accountability of showing up and they know you're going to be there and
Mhm.
you're going to guide them through what to do. It just removes those layers of resistance that make us want to be like, oh, it's too hard, or I don't really have to do that, or I don't feel like it. So I imagine even like, yeah, I imagine that gets so many results for your patients, just having that accountability to be consistent and do the things that you're sharing with them.
Yep. I'm like, okay, I'm going to talk to you in 2 weeks. Like, let's see how many single leg squats you can do. They're like, okay. Most
Yeah,
people are more motivated by having like a workout buddy or a community to
yeah,
work out with. It's just a kind of a human thing, I think.
yeah,
Yeah.
definitely me. It me. Let's finish off on this one. What are some unrealistic expectations you think that dancers have of their bodies generally?
A lot.
Yeah, sure.
I think we expect ourselves to be able to just go and do everything that we demand of ourselves and not realize that we aren't robots. We even our robots need like maintenance, our cars need maintenance, like they need oil changes,
True.
and so we should even more so be treating ourselves well and making sure we're maintaining and we're resting 1 or 2 days off a week, and we're, just taking care of ourselves as humans, because we're just like, I can dance 7 days a week, no problem. I got this. I can do dance and cheer and school. And I just see dancers like, try to do way too much.
Mm,
So, I mean, that as far as scheduling wise, the second thing would be, just like we already talked about, physical things like I
mm,
can get my leg here when your hips don't really do that, so it's just like knowing yourself, being realistic with your own body and maximizing what you have. And then lastly, knowing that things take time. Things take
mhm,
time, and it's better to have a clear plan of what your goal is and like how long that's supposed to take, and
mm.
just being like, okay, I got injured and now I'm in recovery phase for 6 weeks. And like, I'm just going to give it the 6 weeks of like full commitment to recovery, or strengthening, right?
Yeah.
So, things just take time, and it's better when you can just accept that and know your timeline and then just commit to it, instead of being like, oh, I wish this would hurry up and heal. I wish that I could just be better in a week. Like, why am I not better tomorrow? Right.
That's
Um,
so good.
yeah.
Yeah.
So, most injuries that I see that come to the clinic, they take at least 6 to 12 weeks. For like soft tissue injury, it totally depends on like the severity and what's going on and your health and your age and all that kind of stuff. But bones, if you're like young and healthy, take at least 10 weeks to heal.
Yeah.
And then you have like phases of healing for soft tissue. So once you get, dancers will sometimes be like, all right, I'm out of the acute stabbing, terrible pain and inflammation. I'm good to go back to dance.
Oh, that was me. Oh my gosh. Yes.
So, I just got a call.
Okay.
But so there's phases, like I said. So after you get out of the inflammation phase, then you're in the proliferation phase where your body's healing. And you may not have as much pain, but you still have to be aware that your soft tissue is still healing. So that takes anywhere from like 24 hours up to 6 months, depending on what it is.
Mm,
And then after that, this is really where people drop off of PT, is the remodeling phase.
mm,
So once your body heals, it has to get some input about how to heal and like which direction the fibers are going to align. So like a tendon, the fibers should be going this direction, right? Like say you injured your Achilles tendon, it will kind of scar up and heal like this. And then you have to load it appropriately. You have to say, this is the direction I want the force to be. So that's where the PT comes in, and we make you do like certain things that induce a force this way through your tendon so that they can remodel in the right way. Otherwise you end up with like crunchy, bunchy, like scar tissue, crack, pop, right? If you don't go through all of those phases of like get out of inflammation, let it heal, and then appropriately load it so that it can be remodeled correctly. So yeah, it takes time and it takes like expertise. So if you have questions about that.
Yeah, if I knew this stuff earlier, I'm sure you get that a lot, and you probably have said it yourself too.
Yes.
Like, I just remember primarily talking to especially around my knee injury, surgeons, and they're obviously trained to get the surgery done. They're not physical therapists to help you in the recovery process. And also, I mean, this is a whole other thing. Healthcare is so expensive. How many of their patients really are coming back to them consistently when they're supposed to like check in on things? Plus, they're not really like the aftercare person necessarily, from my understanding. So I would be asking the surgeon so many questions about like, okay, this is what's going on. How long will the recovery be, and things like that. And he was telling me, I heard from one person, oh, it's just an arthroscopic surgery, like 8
Yes.
to 12 days. No, sir. I can tell you that. No, sir. It took a lot longer than that. And then another guy was like, oh, 3 months. But there wasn't really any specific guidance on like developing my expectations in a realistic way, and also saying, well, here's what you would have to do to get that best case scenario. Because I feel like I was like so many other dancers, oh, well, I'm going to be the perfect patient and it's going to just heal like at the soonest possible time. Like, oh, you say 8 to 12 weeks? 8. No, screw that. I'll make it 7.
Yeah.
A+ patient, but it's just not that way. And I think that's where having guidance that also guides our expectations, like you do for your patients, is so important. Because I know for myself, I wouldn't have felt so fearful and stressed, at least not to the same level, if I had known it's actually normal that I'm still feeling pain. It's normal that I'm having trouble getting strength again, because I was pushing myself way too soon, just because the swelling went down from the surgery. Like, it's time to go.
Really prolongs your ability. Like there are some joints I tell my patients, like, once you piss this off, it's very hard to unpiss it. Like once you get it mad post-operatively, it will stay mad for like 3 months. So don't piss it off. Like you have to just follow the rules. It's so
Oh my
frustrating.
gosh, yes, my knee has not learned forgiveness. Still.
Still mad.
She's doing better, but she's still a little resentful sometimes. Oh my gosh.
I love that. I always personify people's joints and muscles, which I don't know is like, I'm not sure if that's recommended, but I find it funny. And sometimes I'm like a medium for people's bodies. They'll be like, oh, your muscles.
Medium.
I'll like vocalize their joints. Your joint is saying like, oh, right now.
Like touching the crystal ball, and it's the knee. I'm feeling like you need to chill the heck out and actually rest.
That's pretty much how it goes. Yeah.
Wow, I bet. Oh man. Christa, I would love to know how dancers can work with you. Like, what kind of programs do you offer? I know you shared a bit about the app and your services, but yeah, where can dancers who are interested find you?
Yeah. Well, if you're interested in physical therapy, I would go to my website, dancehealthpt, as in physicaltherapy.com. That's where the health side of it is. And then if you're interested in doing like one-on-one coaching, I would do the app, and you can sign up for the coaching on the Dance Evolution app. And I also have a program for aspiring professional dancers. So just really helping dancers get over whatever physical and holistic boundaries they have to getting there. So that's up and going. And then I'm creating, I'm just like in the process of creating a lot of content for teachers as well. I have like a pre-point assessment that I've created and like exercises and all that kind of stuff. And it's constantly growing. I'm sort of at the phase where I'm like throwing noodles at the wall and just seeing what sticks. So whatever you guys are into, I'll just kind of continue like pouring energy into that. So yeah, I would say the app, or you can find me on Instagram too. It's _dance_evolution
Underscore.
Before, after.
It's really aesthetically pleasing when I look at it. The _dance_evolution_.
It looks good. It's just weird to say.
Yeah, dance evolution, everybody. I'm sure you'll pop up.
Yeah.
Well, thank you so much, Christa. You have been such a pleasure to talk to, and I am sure so many dancers are encouraged by your knowledge and your offerings as well. So thank you
I
so
appreciate
much.
the opportunity, and best of luck. I'm here for anybody who needs help. Thanks, Kirsten.
Thank you. Bye, everyone.
Bye.